And the patient, me, was, several rows down there. It's like, the patient's just along for the ride. The only problem is, they didn't get to call shotguns, so they're sitting in the back seat. They just don't have a play in the game, and that's changing. We're seeing that change because of the way the market's changing. So, what I want to really talk about today is some of the IBM strategies and what we're working on to address how healthcare needs to change and the transformations it's working through. So, in 2005, IBM commissioned a research study on the healthcare issues and some recommendations. And the result of that study was a report that we produced called Healthcare 2015, Win-Win or Lose-Lose. And I highly recommend it. It's about a 50-page report, but it's very concise, has very detailed recommendations. And if you just, I recommend just search it online, IBM Healthcare 2015, and you'll get the link to it. You can download the full report. And it's, I'd read Michael Porter's Defining Healthcare several years ago, if anybody's read that. It's written by Michael Porter, a very well-known Harvard professor who's studied competitive models, and all the problems I was just talking about with the patient not being in control of the healthcare spending is what's wrong with healthcare, and that's essentially what Dr. Porter had talked about. The problem with Dr. Porter is that, he's a Harvard professor, and this book is about that thick, and it's highly recommended if you have insomnia. So our 50-page report is very similar in the recommendations, so I recommend that as a summary, I suppose. So some of the key recommendations that were in the report, just to give you a quick review. The hospitals right now are trying to do all things for all people, and one of the key recommendations is that hospitals really need to transition to where they create centers of excellence. They focus on specific areas where they can specialize, where they can differentiate themselves, where they can show the consumers who are going to have more control of how their healthcare spending, how to, what's different about them, where are their centers of excellence, and then also as being, the large health centers being a triage to direct the patient to the best area of care, whether that's their own centers of excellence or maybe the guy across town that has a center of excellence that's better for that specific care. And, there's enough money to go around that we really feel that it will result in better care for everybody. You'll be going to the best specialist for the specific need you have and be directed in the right area. For doctors, as Dr. Gallman was talking earlier, we need to provide them with better data, better tools. Right now, many of them are, these things are improving in the hospital level, but a lot needs to be done in the practice level to give them the same level of tools to make better decisions and create a better standard of care. And for the health plans, they're really going to be in a role to support the consumers in how they direct their health care and being a good advocate of showing them the way and directing them through this healthcare maze that's very difficult. It's hard to turn healthcare over to the general consumer, even a very educated consumer, and have them figure that out. And that's, I think the health plans will really come into that role and fill a void there. So some of the key technologies that IBM's working on to support these transitions, one of the key ones is health data analytics. There's a flood of data in healthcare, and the problem is that there's still a lot to come. We have genomic data that's coming into the marketplace. We were talking about quantum earlier. The doctor's offices still, there's huge amounts of data in those doctor's offices that it is not digitized, and it's a major piece of the continuum of care that's missing. And so things like what quantum's doing to make it easier for the doctors to automate and just take that off their plate so they can run their practice, so they can focus on the patient, and also allow that data to be digitized, because you can't analyze what you can't see. So that's a key part of pulling that in. It's also going to, really, pulling together this data is going to help prepare the doctors for evidence-based care. It's a key component that you need that full continuum of data in order to provide the personalized care and better standards across the board. And beyond that is the global data integration that we're looking for. We need to be able to access data throughout the world, no matter where we travel, no matter what we do, be able to get to our health records. And Sonia was just talking earlier about the importance of having those tools to create that electronic health record. Probably mine. They're always looking for me. So another area that maybe that's doing it. We'll find out. Another area is we were talking about is the fact that the consumers are going to have better control of what's going on in their healthcare decisions and financing. So one of the things that I've experienced over the last several years is IBM several years ago was one of the first companies to offer a defined contribution plan, essentially a high deductible plan with a healthcare savings account. IBM puts money into the account every year. I can match that money with essentially out of my paycheck, and it goes into essentially what I compare to a Roth IRA. It's going towards my healthcare spending in the future. The difference is I have a $1,600 deductible, and so everything I do for the last, this is going on 3 years now in healthcare, is a decision that I need to make on the cost of that. I had an HMO for years where everything was, I pay $10 and I just get whatever care HMO says I can get. I didn't have to think about it. For the last 3 years, every single medical episode I've had, I've thought about where am I going to go to get this? What's the lowest cost? I guess I'm cheap by nature. I shop everything. I think a lot of people do now. With the tools we have on the internet, I Google anything before I buy it to see if there's cheaper on the internet, it's cheaper a different way. My girlfriend, we just had a problem with the refrigerator a couple weeks ago, and it started failing. I think we got up to probably close to 40 degrees before I had actually done something about it. But I Googled, I looked around, we wanted one of those new French door refrigerators, the real high tech. And just happened to check, another source I always use is Craigslist. And I ended up finding a 3-month-old French door, $2,800 refrigerator. It came out of a model home, never been used for anything but storing a couple bottles of water, for $1,000. So that's what we need for healthcare. We need to be able to make those informed decisions in a matter of minutes on, where should I go? I had a problem last year. I fell off a horse. I don't know if anybody's ever ridden a horse, but a 1,000-pound vehicle with a mind of its own, and it decided to go one way, I decided to go another, and ended up hurting my wrist, and I let it go for, that's another thing. Because I control my own healthcare dollars, it's one of the bad things about it, is you tend to say, maybe it'll go away. I don't want to have to spend that money that I've got in my little medical Roth IRA there. And so eventually, it got bad, and I went to the doctor, and he said, well, we probably need to get an x-ray on it to see if there's something wrong. Well, he didn't tell me where to go. I no longer had an HMO that said, go to this specific one because it only costs you $10. This is coming out of my pocket. So I didn't have, and there's no way for me to easily go on the internet and say, where's the best place with the fastest service that people have reviewed and is the lowest cost? And that's going to come because more people are going to do what I'm doing and have control of those healthcare dollars. The other thing with consumer-driven healthcare is the fact that I think there's going to be demands with the crisis in healthcare. There's demands on the customer to take better care of themselves, and IBM has done a lot to incent us to do that, and more companies are doing that with preventive care rebates and other programs along those lines. But some of the statistics are amazing on just what preventive care can do to fix the healthcare situation. I don't know if anybody saw the 60 Minutes article a couple weeks ago on gastric bypass surgery. And what amazed me was they had about 8 people they interviewed, and all of them were severely obese. They got the surgery, and this was a year later that they were talking to them.